What you want, when you want it, where you want it. This is The Mesh.
Hi everyone, this is Dr. Matt, and you're listening to Take Back Your Health, where we talk about all things health and ways to help you be the best version of you. Well, hey everybody, this is Dr. Matt. This is Take Back Your Health podcast, and I'm here with a special friend of mine, Dr. Jeff Smith with Biokinetics Rehab. Jeff, nice to meet you. Nice to see you.
I appreciate having me. Thank you.
Nice to meet you. Nice to see you. I know you. Look. All right. So why don't you tell everybody listening who you are, what you do, who you're with?
Okay. Well, I'm a physical therapist. I've been in practice for, 35 years probably. And we moved up here from Florida 2 years ago. And so a friend of mine that I met up here had said, you really need to look at doing something in town for therapy. And I hadn't really thought of doing my own business, but it was just a nice opportunity. And I thought, let's kind of look into this and see. And as I started trying to come up with ideas, it just kind of everything was falling into place. And it's
usually a good sign.
Yeah. It's not like we're big into believing into signs of stuff, but it's this is easy. This is just working. And a lot of it, I have helped people in the past, other clinicians set up practices where I was and getting them started, some of my employees that needed to do something different. So I was a little familiar with it, and it just transitioned really well into Hickory. And we've just been very fortunate. We met some great people. It's just making the connections, getting the word out. We've got a lot of supporters, thankfully, in town. The Chamber of Commerce has been just wonderful, which is how you and I obviously met. And it's just been great, just connecting with people and just having a big collegial relationship with everyone. And so it's just a nice thing that we have here.
Yeah, it's great to add somebody like you to our team because, I'm always about health and wellness. I'm trying to grow my team because I want to work with people that I would like to work with, or I want to refer people with. And, because you're a physical therapist and a chiropractor, sometimes people think that we butt heads a lot.
Right. I get that a lot too.
I don't with you, but
no.
Sometimes they do because some physical therapists don't believe in certain things and chiropractors, and sometimes we try to what do they call it? Stay in your lane kind of thing. But we don't tend to do that.
No.
Which is great because that's why I want to have you as a referral source. So, speaking of which, as far as physical therapy, kind of. What's your spiel on physical therapy? What do you kind of use it as? I say, because there's so many different things: a rehab and
Correct.
Coming from injury, correcting your form. Most people when they think of physical therapy, they think rehabbing an injury, you have surgery, you have to get back out there. But what is your kind of spin with it? Because I know you kind of specialize more in further than that.
My goal is to try to be there wherever the person is, meet them where their needs are. And sometimes it's trying to figure out, they may not know where their needs are. And so, yes, I might have somebody that comes in post-surgical and they're like, okay, this is an obvious thing. And that's what people think of. Or I'm having pain and I come to see you. And that's wonderful. And my goal is to try to reduce their symptoms just like yours is. But it's also then, let's take this further. And I think what kind of sets us apart a little, and it's not to ever knock anybody else in town. We've got some great therapists throughout the area. Absolutely. But it's the emphasis in a lot of clinics now.
Everybody brings their own style.
They do. Yeah. Oh, absolutely. Yeah. But there's also a lot of push nowadays that you've got to get in there and get a certain amount of units, and you can only do what insurance allows and things. And it's great. I understand there's got to be some control of that. But a lot of times people need more than what somebody might be telling them. So if you have somebody on the outside that's not a clinician, that they're looking at the numbers only and pushing that you've got to see somebody every 20 or every 30 minutes, and they're seeing 13, 15, 20 patients a day, the quality is going to suffer. You cannot spend the time with somebody. My goal is to try to also educate that come to me before you're having problems. If you start to notice, I'm not doing as much. I'm limited. I'm not able to get out and participate the way I want. I'm having trouble getting down on the floor. I want to go out and just run or sprint or jump. Well, then that's the time to come and let's take a look and see what's going on. Let's not wait until you're hurting, waiting until, I need pain meds, I need an injection, I need surgery. A lot of times we can avoid a lot of that. There are some things, if it's a degenerative condition, I can't make arthritis go away.
Neither can I.
Yes, but I can improve the symptoms. Maybe we're delaying the inevitable a little bit, but sometimes people aren't ready for something. And, they want to get to a different level. And I'm big into prehab. I want to bring in people and let's build you up prior to surgery. If you know you're going to have surgery in 2 months, good, then let's work you out until then so you recover so much easier and you know how to manage after, and that's missing.
And that's a great way to do it, because you're not just, oh, you had surgery here, we'll get you in for like 6, 8 weeks, whatever, how long it's going to take, and then you're on your way, versus like, I don't know what to expect. And you can kind of actually help the patient kind of prepare for something they're not prepared to do.
Yes, that's right.
I mean, you've had patients have these surgeries and things that they need to, so they're scared. They don't know what to do. They don't know what to expect. So you're like, hey, in my experience, this is what's probably going to happen. So I'm going to prepare you for this, so that way when it happens, that you don't feel like you're lost.
Right.
Which is a huge thing.
And it's even the things of how, I'm going to have shoulder surgery. How do I now dress, or how do I shower? What do I do? Because I'm going to be in a sling. I'm not supposed to move my arm for the next 4 weeks. What do I do? Or I'm not used to using a walker or crutches. How do I go up and down the steps? How do I get in and out of a car?
Things you don't teach you.
No.
They just give you this stuff and say, hey, see ya.
That's right.
Figure it out.
And unfortunately, a lot of times people are being handed an exercise program and just go home, do this. We'll get you in when we can. And it might be weeks before they're seen. And to me, in fact, I had somebody just this morning that called, and she said, my husband had surgery in November for his back. He had a multi-level fusion. And he's going to get released soon, so we really want to start therapy because he can't do things. And I'm thinking he should have been in here in December. It's there's no reason why I didn't see you then, but not that I'm going to tell them that, but I thought, boy, it's a shame. No. Yeah. And unfortunately, it's just not being referred. And, sometimes people think, and I've had, unfortunately, physicians, surgeons in the past that have said, well, I've stabilized the spine, so they don't really need to see you for anything. Like, no, you've structurally rebuilt some things. That doesn't mean that equals stabilization nor function. They need to know how to now work around that. Plus, they've been probably going downhill for a while before this procedure. So let's kind of rehabilitate that way.
Do you, first of all, do you have to have a referral to come see you?
No, I'm direct access in the state of North Carolina. Anybody can come in. So that does make it a lot easier. It's a little different than what people are used to. And the nice thing is you don't have to now wait 3 weeks to see your physician to get a referral to say evaluate and treat.
Exactly.
Which is very frustrating.
You're not at the mercy of them because you're your own independent, saying you don't work with insurance either.
Correct.
Yeah.
Yes.
So that now you have even more freedom.
Yes, exactly.
Which is great, which is why I like to operate, because you don't like to be restricted, because you don't have to have a referral, because a lot of people think that, like, well, do I need to have a referral from my doctor or my surgeon to go to PT? No, you absolutely don't. Because you don't just treat injury.
That's correct.
You treat athletes, and you treat people that are just trying to figure out a different way to move because their body can't handle that anymore, right?
That's right. Yeah. Correct.
So that's a great thing to know.
And it was very nice. Like the other night, I had a former patient that called and says, my husband's knees are really bothering him. He's having trouble. He's not playing tennis. Can you get him in? Yeah, I'll get him. I got him in the next day. It's like, no problem. I'll get him right in. But it's not that we have to wait and go through the expense of, we need to go and see my physician and get a referral and all of this. And I've got to copay to the physician to come to see you. And they didn't touch me. And it's, again, there's definitely a time and place. And if I see somebody and it's like, there's some red flags here, something's not making sense, I'm going to send them. So you need to go see your physician. I'm not liking what I'm seeing. I want an x-ray of this. Maybe we need to look at an MRI. Maybe we need to have something more. If they're in so much pain, maybe you need to be on some medications. Maybe you even need an injection, unfortunately, if you're hurting that much.
But it's great to have somebody like you as the kind of the gatekeeper.
Absolutely.
Because you can, number one, refer them if they need to and tell them and give them ideas of where they need to go, but you can also save them a lot of time and money.
Absolutely.
Because if they need something that's not really serious at all, they can go get it with you and get it treated, versus going around the long way is what I call it, when they come to you at the end and they're like, why didn't I start here?
Yes, exactly.
Because that's not the medical model to do that.
Unfortunately, it's not. The incentive is more, and again, it's not to knock, but if your limitations are as a physician that I can give you a pill, I can give you an injection, I can do surgery, or I'm going to send you elsewhere. Well, I'm going to try to do what I can first.
Exactly.
And it's not that it's wrong. It's just, this is what I know. This is what I have more control of. And that's perfectly fine. But I look and think, but this is now weeks that maybe this person's in pain. Their quality of life is decreased. Maybe they're not able to work, or maybe they're not enjoying things that they want to do. And if I can get them in and save them time, it's going to make the recovery so much better in the long run as well.
Exactly. Well, now, because we talked about that, what are some of the biggest issues that you usually treat on a daily basis? Is it more athletes? Is it more rehab? Like, what do most people come to see you for, I should say?
Actually, it's a big variety. When I first was starting, I thought it was going to be so much of an orthopedic standpoint. And that's my specialization. I'm board certified in orthopedics. I thought I'd have a lot of sports athletes coming in, whether it's the weekend warriors or the high school collegiate, whatever, coming in that way. And I do have quite a bit of that. I have a lot of kids from the colleges and the high schools coming, but I also am getting those weekend warriors that, okay, I injured myself over the weekend, or I did something out in the yard I shouldn't have.
Pickleball this weekend, and I hurt my knee. Yeah, exactly. Yeah, I hear it all the time.
But I do have patients that have had stroke. I've had people that are deconditioned. I have some people that are just less active and they don't trust their balance anymore. They've had some falls. They're fearful. They're tentative, and now their function is decreased. So my schedule is all over the place. There's areas that I just know I'm not going to get too deep into, but if I feel comfortable, by all means, I'm going to do what I think is best for somebody. I have worked inpatient neurological rehab in the past, so I feel very comfortable. If I have somebody with spinal cord injury, it's a little tricky where I am. Traumatic brain injury, a little tricky as well. But when I have somebody that had a CVA, or maybe I have somebody after a heart attack and they finished their cardiac rehab, but they're not where they want to be. That's really my biggest thing.
And that's another thing I hear from some people too when they go to physical therapy is like, well, they either only told me to go to so many visits, or they stopped me after this many visits.
Yes.
And they're like, I can't really get you any further.
Right.
And then they kind of just take their word for it. And then they're just like, well, I guess this is as far as I can go. So you can help take them that extra step.
That's the hard thing with insurance a lot of times now is if they're functional, it's time to discharge. Well, yes, I can walk up and down the steps, but I can't go hiking.
Exactly. I can do what I like to do, but I can get around my house. Exactly.
Right. I can get out of the bathtub, but I can't get on the floor to play with the kids or grandkids.
Exactly.
So that's my goal is, okay, yes, that's perfectly fine. If you've seen another clinician and you've done therapy and you've finished up what you're doing, but I'm not where I want to be, then yes, that's my time to jump in and do it. And I've had some patients that have contacted me and I said, you know what, use your insurance benefits now for what you're doing. That's perfectly fine. Yep. And then when you've gotten to that point where they feel like it's as far as they can take you, now come to me. And I just 2 weeks ago had somebody that was in a very bad motorcycle accident. And I said, at this point, use your benefits.
Yeah.
Perfectly
you
fine.
You got to use them.
But we know you've got a lot of therapy ahead of you.
Yeah, exactly.
So I'm going to see you eventually. I don't mind. I just want you to get better, but this is going to be more cost effective for you now.
Course, yeah.
So go do that, and then I'll take care of you the rest of the way.
Awesome. And that's why I titled this one, the retraining, regaining, because that's kind of what PT is. You're retraining the body to learn how to recover, and you're regaining that confidence, you're regaining that structure that you lost during some event, either injury or surgery, things like that.
Absolutely.
And that's why I say PT is a lot more than what people give it credit for. Especially nowadays, because you're more holistically minded, like I am, because you don't do the insurance, you don't limit a patient to, well, if you're doing this is where I can get you. You might just need to go talk to your surgeon, things like that. You look at the body a different way, and you look at it as a whole, which is great because that's how I look at it. And you have different services in your office that you offer, because you have your own little personal gym in there.
Yes.
But what other services do you have in there?
So I do have 3 personal trainers that use the space there, and we work together. And it's sometimes, they will have a client and they say, this is a little bit beyond my scope for what's going on, or you have an injury. Let's let you see PT for a little bit, and vice versa. When I'm finished with somebody, it's like, you really need to continue. And I think it'd be great if you work with one of the trainers. You don't need skilled therapy.
3 trainers in that?
Absolutely.
Space?
Yes. Yes.
Is Mandy one of them?
Yes, she is.
Okay, I thought
she's wonderful.
Okay, yes. I was saying Mandy was great. Yeah.
Yeah. So
Mandy has 3.
Yeah. So Mandy does a lot of more functionally based care and nutrition consulting, lifestyle coaching in a sense too. Just really, she'll do online work and everything. Just wonderful. Brian Williams was with Burn Boot Camp, and Brian is just highly motivated person, just wonderful to bring in there. Gotcha. And they look at things a little differently. And then I also have Warren McAlpine, who works at the YMCA quite a bit, and he's a power lifter. So sometimes he's working with people that really want to build up strength and explosiveness, but other times he has people I just want to get stronger and better.
Yeah.
So it's just really nice. They all complement each other. They're not competitive because they all have their areas. So when a client would say, okay, where should I go? It's like, you really need to talk to him and see where your fit is. It's nice to have a variety there. And then we also have a massage therapist, and Renee Barnett is there, and she's wonderful.
You've improved a lot.
Yeah, so it's definitely growing, and we're at that spot where I'm bringing on a physical therapist assistant hopefully soon. We're talking next week, and just
good gracious, Jeff.
So it's
what are you?
really
haven't
nice.
seen you in a while.
That's correct. It's been very blessed. Yeah, we've had a lot of just wonderful support in the community. The word of mouth has just been just phenomenal.
I heard you've been blowing up, which is phenomenal. Yeah, I know.
Yeah, very appreciative. And it's I think we're offering something that people really want. They want that concierge type of approach.
Exactly. They want the custom.
Somebody that's going to listen.
to you.
And you don't want to
Yes.
go and just say, I can, you're complaining that your neck hurts and your shoulder hurts. I can only see you for one of them. It's like, no, they're connected.
Exactly.
Of course, let's look at the whole picture and try to figure this out. And that's where I think a lot of where we're seeing medicine is going. You see that as well. And we see that with holistic medical practitioners out there. And that's how it should be. It's that I've got a problem. I don't really know what to do. I need somebody to kind of run this for me. So if I can be that person, like you mentioned, the gatekeeper, regardless of who it is, I don't look at like you and I as competitiveness. It should be collegial relationships.
It should
Same
be.
with other therapists in town. We got some great clinicians in town that, I like, I'll see somebody that's like, I really like to go over here for therapy because I think that what they're offering is something that I'm not. And I think this would be a good fit for you. So I really have tried to go back and forth with people. And I've got a number of physical therapists, a number of chiropractors, a number of massage therapists, dentists, orthodontists that are sending me patients. They're like, hey, I've got somebody with TMJ and I can only do so much with them. They know that I can get in there and do dry needling and different massage techniques and work on their posture and look at their range of motion at the neck and try to adjust things and really make a difference.
Oh, excellent.
So it's just really trying to look at the big picture of what do people want.
And that's what makes people like us good practitioners, because we don't limit ourselves to what we can help.
Yes.
And we keep good relationships with other professionals, because I don't know everything. I'm not skilled at everything. Like, if I need to send a patient to you or somebody like that, because I don't look at like the exercises and all that kind of stuff. Patients
Right.
ask me all the time, what stretches should I do? What exercises should I do? I don't study that much because that's not my like passion, but I would
Right.
refer that to you or Mandy or something like that, to say, hey, well, this is what they do, and they are more skilled in this, so they would be a better fit for you.
Yeah.
Now, you mentioned the PT, the rehab, and all that, and the personal training and the dry needling. What other services do you offer in your clinic?
So I will do things like cupping, scraping, joint mobilizations, manual stretching, all of that. I have had the recovery services as well.
That's why I was
And
getting to that.
yeah, so I have 2 plunge tubs, infrared sauna, and compression sleeves, and we have a lot of people that like to use that for their recovery. It's just wonderful modalities. I'm hoping to maintain those services. Right now, we're a little bit on the fence because I'm getting to the point where I need a little bit more space. So I'm kind of torn as to what I want to do with that.
Gotcha.
But I just love having those services for patients. And I have some of my people I see, it's more of, I will get in there and do some body work on them and say, okay, let's get you on some sleeves, or let's put you in the sauna for a little bit. I just do that free. Just go and use it. I don't mind at all, at all. If I have somebody that says, I'd like to come in and use this for 45 minutes, the first time I say, come in for free, try it. I'm not going to charge you anything for it. But you may love it. You may not like it at all, but I don't want you to feel like, oh, I've spent $45 for something that I don't like at all.
Yeah, exactly.
But then if you think, I've got a number of MMA fighters, I've got some construction workers, some of my athletes at CVCC, and they say, I love coming in here and just being able to go back and forth between the modalities, then it's great. I love having that service for them.
Yeah, that's great. And I think, I'm sure you agree with this too, one of the big things I try to tell my patients is the importance of knowing how your body works, but also knowing what to do when it doesn't work.
Yes.
And that's why I had we did that podcast with Mandy a while back. And we're talking about, it's never too late to start, because most people will tell me, because I have patients that tell me, I had a patient the other day, and she's probably like, I think 42. And she was making an appointment for her husband, and I asked her, would you like to make an appointment for yourself? And she said, I haven't been to see a chiropractor in 3 years. I'm probably not qualified or something. I'm like, who said you're not qualified? You're overqualified.
Yes, that's right.
So people just don't really know. But I really appreciate you coming on here and taking some time to explain.
I appreciate it.
PT.
Thank you.
But before we wrap up, how do people get a hold of you? How do people schedule an appointment with you? Where are you at?
Okay.
Kind of give that information.
So we're at
Biokinetics
837
Rehab.
13th Street, Northeast. So if you're coming from downtown, you're going out Highland Avenue, about 5 blocks east of Lenore Rhine. If you're coming in from Springs Road, people see the fire station and the water tower right across the street from that. And that's usually where people know.
Yeah, the landmarkers.
That's
yeah,
right.
Yeah.
Being new to the area, I can't find my way with all the one-way streets, so I plug it into
don't think
Google.
anybody can.
No. But so that's where we are. It's we just, again, got a very wonderful facility, great opportunity there. The website is www.biokineticsrehab.com. And that's, where you can at least see what the facility's like, get to see who the trainers and myself are, get to learn a little bit of everything. I have blogs on there. So a lot of information on the website. And people can send a text or call me. The phone number is 828-528-1222. So whatever's easiest. My goal is to get people in within 24 to 48 hours if they like. I don't want anybody waiting weeks. If they're needing me, I'm going to do whatever I can to get them in right away, get them started on something.
And that means a lot when patients are saying, oh, yeah, I got an appointment with my surgeon, but it's going to be like 6 weeks before I can see him. I'm like, what am I supposed to do for 6 weeks? Like, just kind of deal with it? It's like, well, no, they can start with you to kind of get some prehab.
Absolutely.
And then have a better, stronger, more confident journey.
Yes.
Well, that's awesome. Well, thanks for coming out.
Oh, thank you so much. I loved it.
If you'd like to learn more about something you just heard, or are interested to see how chiropractic care can help you, you can visit our website to schedule an appointment at newdirectionschiropractic-nc.com. Be sure to follow our social media accounts for more tips and information on how to be a better you. Thanks for listening.
You've been listening to The Mesh, an online media network of shows and programs ranging from business to arts, sports to entertainment, music to community. All programs are available on the website as well as through iTunes and YouTube. Check us out online at themesh.tv. Discover other network shows and give us feedback on what you just heard.